interviews, and even some of the key informants were not able to basically integrate the questions in English, so we had to have the tools translated into Swahili. So the pilot was done in Navaholo sub-county. We went to Bushiri Health Center. We had 2 focus group discussions with the focus group discussion had a combination of pregnant adolescents and adolescent mothers. We also had a key informant interview with the nurse in charge in that particular facility. She was a nurse in charge of reproductive health. We also had key informant interviews with the village elders and 2 community health volunteers. Immediately after modifications that were required in terms of sequencing some of those questions to ensure that there was flow in the questions. There were also some wordings that were changed in a way that then would make the interviewees understand some of the questions. So we had then the tool refined both in English and Swahili before the actual field work. Next slide, please. Since the process of fieldwork involved a number of stakeholders, it was necessary to develop a mobilization strategy. So in collaboration with CISP, we developed a mobilization strategy basically to help us organize the field activities, how we were going to reach out to the participants, where would we find the participants, which methods were basically going to be used to collect that information. So the mobilization strategy was developed and it facilitated in reaching out to our interviewees. This was done closely in collaboration with our mobilizers who were on the ground, in collaboration with the community focal persons. The study was basically done in 2 sites. That was in Matungu and Mumias West sub-counties. And I think the reason why it was in these 2 sub-counties had been explained earlier on in the presentation that were done previously. Next slide, please. I think we can move to the next. That's just a map showing the study sites. We had a pre-interview phase on the actual days of the interview, where participants were given opportunity to be able to understand what the research was all about as per the research ethics, and to ensure that their rights were not being violated, and that they were participating willingly in this particular study. And once they were taken through that session, they were then given opportunity to give consent before they participated. We had a team of 6 research assistants In that team, there were 4 female research assistants and 2 male. And the reason why we had male and female is because there were certain interview that would require, for example, a particular gender to be able to interview. For example, in the focus group discussion with pregnant adolescents or even adolescent mothers, it was appropriate to have a female research assistant interview them based on certain cultural worldview from our different backgrounds. So next, please. There were 2 methods that were applied in getting information or collecting information in this particular research. That was key informant interviews and focus group discussions. We had a total of 49 key interviews which were undertaken. I'll show you a summary of the stakeholders that we were able to reach out to. The interviews were audio recorded, so all the focus group discussions and the key informant interviews were recorded. The sites and the venue where the interviews were conducted were generally central, reachable venue to the participants. We used churches, we used health facilities, we used the chief's camps, and we used schools in situations, for example, where we had key informant interviews with the teachers in schools. Then those were conducted at the school level. We interviewed the healthcare workers in their respective offices. So there were different venues that we used for the study. The key informant interviews took a maximum of 40 minutes. Some were shorter, but the maximum time taken was basically 40 minutes. We collected data for a period of 2 weeks, and in our focus group discussions, we had a moderator and a note taker. Basically, for the key informant, we only had the interviewer, but for the focus group discussion, there were both moderator and the note taker as well. For the focus group discussions, we had a total of 32 focus group discussions which were done, and there were a number of questions and probes in the focus group discussion guide that was used. We took into consideration gender and age in the formation of those focus group discussions. We had a minimum of 6 and a maximum of 10 participants in each of the focus group discussion. In the event that we didn't have the minimum required numbers for the focus group discussions, then we did not undertake the focus group discussions. That was the case, particularly for the focus group discussions that we had targeting pregnant adolescents. We were not able to get enough numbers, so in most of the focus group discussions, then we had to combine pregnant adolescents and adolescent mothers. And generally, the focus group discussions took a maximum of 1 hour. Some went slightly longer, but it went for about an hour for the focus group discussions. You will allow me to move to the middle because I can't see from that end because of the font. I hope I am not. You can see it. So we reached out to a number of stakeholders. Basically, in terms of the numbers that we were targeting versus what we were able to do, from that table there, you can obviously see that we were not able to interview the stakeholders at the national level. We tried to reach out to a number, but those interviews, including interviews on the phone, somehow bounced. It was very difficult to get them. I think we tried twice. Claudia tried a couple of times to reach out to the contacts, they confirmed, but...
Sorry, Dr. Olayo. Can you hear me?
Yes, we can hear you.
Yeah, no, just to confirm that we managed to have 3 national stakeholders, one from MOH, national level, one from US8, and one from UNICEF. That's all we managed to have.
Okay, so that happened later. Okay. Then we had other stakeholders at different levels. If you look at, for example, the